Hi, Dr. Baumholtz, and today we're going to talk about capsular contracture. Now, what is capsular contracture, or CapCon? So, a capsular contracture is no more or less than the scar that forms around an implant. By the way, the body does not care the difference between whether you get a splinter in your finger or have an implant in your chest. It's viewed as a foreign body, and the body tries to wall it off. And in the case of a breast implant, it has to have a special name, so of course we call it a capsule. And this capsule can rarely, but can get hard, contracting. So it's called a capsular contracture. Some of the features of a capsular contracture is the breast can get firm, it can even get hard, it can even get painful. It has more of a round or stuck-on appearance than it may have after surgery. But usually the hallmark is someone will come and say, gee, it feels much firmer than the other side, or it just feels like it's getting hard, or it's got that sort of stuck-on look. What do we do about it? Generally speaking, the hard part is we've yet to find a great solution for capsular contracture. We've yet to identify why some people get it and some people don't. We do believe there's some genetic component to it. We've yet to identify a really great strategy for managing it. So it's not one strategy suits all. So in our practice, what we do is sort of a three-prong approach. We start with some simple massage. Involves the patient. It gets you to know what's happening and feel it and help sort of stretch a bit. There are some oral medications. There's not a lot of data on these, but they've got really a low risk profile. So there's some oral medications that we will try, typically for the period of a minimum of 3 to 6 months, to see if we can make a difference. And then if we can't, or if it really has progressed into the later stages of capsular contracture, we're going to talk about a surgery to go and remove the implant and the capsule, and then likely put a new implant in. Although there are some people, very rarely, where their body keeps making capsular contractures. And in those scenarios, again, very rarely, my recommendation is that person may do better in life without an implant, period. Or we get into using what's called biologic meshes or biologic materials to try to break the body's own strategy of building scar around it. And this can be helpful, but it becomes pretty expensive pretty quickly. Someday soon, we hope to have a better solution for capsular contracture, but that's sort of the state of the art at the moment. So a three-part approach: massage, medications, and then surgery as a last resort for capsular contracture. Most patients we can get by with just the first two options. Rarely we have to consider the third, and even rarer still do we have to tell someone, look, we think life would be better for you without the implants. But again, that's really rare. Capsular contracture does not seem to be more associated with silicone versus saline. I wish we could identify one versus the other. We'd probably all go the opposite direction. But that's sort of a brief overview of capsular contracture and what to do about it. This is Dr. Baumholtz, and thank you for listening.